Good afternoon, everybody who's trickling in from the waiting room. We're going to get started shortly, but I just want to give people a minute or two to get into the room. Good afternoon, everybody. Thank you so much for joining us today for this special Lunch and Learn webinar on the key role of health equity in addressing the climate crisis and other environmental risks, with our guest presenters, Mariya Belgrezebna and Sean Kidd from the Center for Addictions and Mental Health. It looks like we're a small group, but there may be some more folks joining us while we get started. So I am going to go ahead and get us started with some quick housekeeping. Now you're all almost certainly Zoom pros by now, so we can keep this pretty quick. Just as a reminder that all of the microphones are muted by default. You can enter your questions through the Q&A panel at any time, and try to use the chat function for things related to technical assistance. But we'll be watching both for questions. And then during the Q&A period, you can also use the raise hand function, which is under reactions, if you would prefer to ask your question aloud, and we'll unmute you when we call on you. We'll just ask you to remute yourself after you've spoken in order to minimize background noise. So now I'd like to get us started in a good way by acknowledging the original stewards of the land where we are virtually gathering today. We recognize that the work of the Alliance for Healthier Communities and our members takes place across what is now called Ontario, our traditional territories of Indigenous people who've lived here since time immemorial and have deep connections to these lands. We further acknowledge that Ontario is covered by 46 treaties, agreements, and land purchases, as well as unceded territories. We are grateful for the opportunity to live, meet, and work on this territory. Ontario continues to be home to vibrant and diverse Indigenous communities who have distinct and specific histories, needs, and assets, as well as constitutionally protected and treaty rights. We honor this diversity, and we respect the knowledge, leadership, and governance frameworks within Indigenous communities. In recognition of this, we commit to building allyship relationships with First Nations, Inuit, and Métis peoples in order to enhance our knowledge and appreciation of the many histories and voices within Ontario. We also commit to sharing and upholding our responsibilities to all who now live on these lands, to the land itself, and to the resources that make our lives possible. My name is Catherine, and I am a settler here. I live and work on the traditional territories of the Anishinaabe, Wendat, and Mississauga peoples in what is now called Ontario. So I'm going to quickly introduce our guest presenters before I turn the floor over to them. Sean Kidd is an associate professor of psychiatry at the University of Toronto and is the division chief of psychology at the Center for Addiction and Mental Health. His work has concentrated on research with marginalized populations, including trials of community-based interventions for individuals with schizophrenia and youth who've experienced homelessness. Mariya Belgrezebna is a research analyst at the Center for Addiction and Mental Health, working on the Canadian Poverty, Health Equity, and Climate Change Initiative. And with that, I'll turn you over to Mariya and Sean. Thank you so much both for joining us.
Great, thanks so much for that introduction. Maybe I'll defer to Mariya to drive the slides here. I might just add that Mariya and I are also participating in this call from Ontario and Treaty 13 territory, Mississaugas of the Credit, Huron-Wendat and Haudenosaunee. And I think the topic at hand here has many points of relevance to Indigenous communities in Canada and the histories therein, and just in terms of thinking about the impacts we're going to talk about today and the drastic overrepresentation of First Nations, Inuit, and Métis people amongst people experiencing homelessness and the many exposures that happen there, and certainly thinking about the displacement related to forest fires. Had a case study that we plan to get going in Yellowknife with some Indigenous partners up there, and with my youth homelessness hat on, that had to be indefinitely postponed. And you really see these impacts, but as well, along with impacts and risks, thinking about the risks, of course, too, that are a part of a history of colonial violence, but thinking about response and building responses, and the humble approach we need to take with our First Nations partners, our Inuit and Métis partners, to help us design a response based on long histories of land stewardship and doing so much better than we have in many ways in engaging our natural environments and being a part of it. With that said, I guess we can get started. We've done some intros. You know who Mariya and I are, based out of CAMH here in Toronto, in the west end of downtown. Just in terms of the funding that we have, been funded by the Canadian federal government, and most recently the McConnell Foundation, and that kind of is the backdrop of this work here with no real conflicts of interest to disclose. We can kind of keep on moving. So what do we hope to accomplish in the short time we have with you? And I should say as well, we're going to try and keep our talk to half an hour or so, because we don't want to leave plenty of room for some questions and discussion, and to hear from you all about how these topics, these issues are manifesting in your work and your space, questions and points of debate, all of that good stuff. So in terms of what we hope to cover here, we can do a little bit of Climate Crisis 101, and they'll probably keep that pretty light, given that it's all around us all the time in terms of media and what we're hearing. There's a lot of, certainly resources we can steer people to read a lot more. We're going to really drill down, though, on specific implications for populations that are experiencing health inequities and other inequities, and the implications of the climate crisis there. We're going to not talk as much about risk as really response, and this is, I think, where we need to go in this space, is what do we need to do to address this risk. And I mean, it's an unfortunate point to get momentum from, but I mean, this summer, Jesus, it sure doubled down on the relevance of these issues. And in Canada, it can seem abstract compared to other parts of the world that are more impacted, but it certainly has doubled down, I think, the relevance to all of our work if we're working in social responses, health-related responses, and others in all areas. I'm going to give you a few case examples, some good examples of emerging work that's useful. Then talk a little bit about what's the state of evidence here, and what are experts saying, what should we be doing. So that's our intent, to cover that ground a fair bit. As promised, I'm going to keep it really short on the climate crisis impact piece. A really good source, like kind of a compendium that's updated every year, is the Lancet Countdown series. So this is a systematic kind of review or scoping review of all the best available evidence on the physical and mental health impacts and implications of the climate crisis. Leading experts around the world author it. It's a bit of a long paper, but it's a great go-to if you just kind of want to know all the ins and outs of where the problems lie, and also where the responses need to go. It's a really nice summary. And the next one, the 2023 one, should probably be out this fall. But here's a link. It's publicly accessible through Lancet. But I'll cover things briefly in terms of like what are climate risks and impacts. You'll probably be familiar that we've got this sort of acute situations, the immediate threats, severe storms, fires, flooding, those kinds of immediate threats to health and well-being, heat waves, those sorts of things. And then you've got the more indirect threats to health and well-being, things like air pollution, smoke in the air, those kinds of things. And as well, vector, waterborne disease, illness, kind of seeing things like tick-borne illnesses, for example, appearing in far greater numbers and with prevalence in Canada. Like these sort of fall off or subsequent impacts that fall on the heels of changing climate, of weather crises and disasters and so on. And how the impacts play out is certainly people with respiratory cardiovascular challenges. I think you might have experienced this or seen people experience this summer with the forest fires. Anyone with some vulnerabilities there is having a really tough time in many places in Canada. The ability to work and exercise, many of us probably on this call have the benefit and privilege of working indoors, but for folks who work in construction and various outdoor sorts of capacities, these heat waves are life-threatening and threaten people's abilities to make a living in terms of risk. I've already covered, there's the immediate risk of things like fires and storms, risk of injury, those sorts of pieces. And then I like as well, of course, all of the other pieces that fall out from that. And, we're very privileged in Canada in terms of food, water, and energy security. Not perfect by any means, but a privilege there compared to many parts of the world where this is dire and drastic, where people are literally running out of water and having farms fail and these sorts of things happening. And then as well, a topic that gets less attention is displacement and violence. We see in many parts of the world, large populations moving and fleeing affected areas, and then violence as well. And this is certainly relevant to Canada. If you look at even the data on 911 calls related to domestic violence, is what happens during heat waves. It really spikes, and of course you look at who is impacted by that, and it's most often women experiencing violence in these scenarios, and all of these pieces come together. So just to give you I'm trying to give just a super fast scan here because there's an awful lot. I do encourage people to go to the countdown documents and other sources for this general background. Go ahead, Mariya. We can go on to the next slide. Thanks. The climate crisis is framed as a threat multiplier, and by that meaning that if you're already facing some challenge related to any number of factors, it doubles down related to climate change. And you'll have seen this, I'm sure, in your own practices in your lives in different ways. So children and youth, for example, the hot topic, as it should be, is mental health challenges of children and youth related to climate change. And I think many of us see this all the time with the children and youth in our lives who are feeling hopeless and helpless and angry about what's happening and all of the pieces that flow off of that. There are developmental implications. If you are in school environments that don't have adequate air conditioning, children exposed to homes that are overheating, and sleep implications, all of these cascade right down the line in terms of cognitive brain development, other pieces. So children and youth face unique risks. Homelessness, we're going to talk a fair bit about, but obviously the most exposed people in all of this are people who lack adequate shelter. And if we consider homelessness broadly to include inadequate and really bad living circumstances, the kinds of terrible boarding homes and temporary dwellings many people are in, those are also highly exposed spaces. And these are populations that already have health challenges, physical and mental health challenges. The Western Heat Dome in 2021, a large proportion of the many hundreds of older adults who died had schizophrenia and severe mental illness. And you can kind of see these intersections of challenge that occur. Older adults I just touched on. That's an obvious one where we see heat waves in particular, but also other disasters that happen is, how we respond. And we see illness, morbidity, and mortality flowing off of there. I've mentioned women's health. Another topic that's certainly there is, for women who are pregnant, who don't have adequate access to cool spaces, the implications for maternal health and fetal development are quite significant. And then other groups, other intersections, very intersectional kind of thing, is Indigenous populations. I touched on a little bit in my acknowledgement there about exposure. We see this in Canada, very recently and currently happening, and also even looking at building standards on reserves and just housing that's not adequate up to the task of dealing with weather extremes. Racialized populations, this is a huge topic. It's something like looking at environmental racism, as it's called, is the disproportionate number of Black racialized populations who are overexposed to climate pressures, but then also, importantly, not included in the conversation about response. There's a major inclusion gap there. And people like Ingrid Waldron, Adam McMaster, and others are trying to make a difference in just how racialized populations are engaged, both acknowledging risk, but also being represented in responses. And then last but not least is persons with disabilities is routinely not included in thinking about, especially disaster response. If there's a flood, if there's a fire, what's happening with people who have a range of disabilities. You can go ahead there, Mariya, thanks. So I've already kind of bounced around here a little bit. Some of this I've covered already. So what do we have in hand right now in terms of efforts to date? I already touched on this, but there are certainly disaster response plans that are more inclusive, but most aren't. Most haven't really systematically thought if there's a flood, a fire, an evacuation that's needed, these sorts of things, is what are we doing with populations that are experiencing homelessness? Look at what's happening, particularly in the US with hurricanes, fires in Australia. You have very exposed populations that first responders don't ever get to or don't know how to reach, as well as people with disabilities, older adults who might not be, they might not be paying attention to the news and social media and the kind of forums and mechanisms through which warnings and response plans come together around and are not included. So that's often the state of affairs. And in terms of adaptation and remediation plans, many examples here, but if you look at, for example, the adaptation and to some extent it's climate mitigation strategies around what's happening with housing. Is how do you make housing more resilient to weather extremes, also less emitting, using natural gas and so on, is the vast majority of these plans are geared towards middle class and up. These are expensive strategies that have very little relevance for people who might be renting somewhere or just not have the means to kind of manage these sorts of responses. And some things can backfire too. I mean, a really powerful response to the climate crisis is obviously adding green space to cities, right? As you kind of increase the canopy, more cool spaces, also some mitigation implications there. But it's been found that when you do this greening of urban spaces in areas where there are socioeconomic disparities, you often get gentrification hand in hand with that, because you're kind of making those spaces better, as you should. But what happens then is you speed up gentrification and people are moved along. So it's just kind of thinking through how these plans are set up so that they address the needs of people experiencing poverty and other challenges. And then what with our standard fares, so what do we have? And this is what actually got me into this space in the first place. I'm a latecomer. I'm about 3 or 4 years in now into this climate business, other than being a concerned person and worried about my kids and family and the world. A lot of my interests in projects come out of things that make me annoyed and angry even. And one of them is heating and cooling centers is the go-to response, because we know it's just inadequate, right? Is the vast majority of people who need to be cooled off in the summertime and warmed up in the wintertime never get to these places. And it's not nothing. I mean, certainly lives are saved and they do make a difference. So don't hear me saying they shouldn't be done. But if this is all we're offering, it's really not cutting it. And there's lots of evidence around that. And even if you consider where they are and where they exist, the vast majority of people who experience homelessness die related to weather. They're dying actually when the temperature is wet and at around 0 degrees. So the warming centers aren't even open at that stage. And that's when around the world in comparable countries, in Canada too, that's when we see most deaths. Perhaps that's related to the fact that the warming centers aren't open then. But we often, in our housed minds and our housed experience, we don't really appreciate that if you're exposed all day long, you got health conditions, that it doesn't need to be -20 before you're at risk. And then given outreach with water bottles, supplies, education. I mean, this is sort of standard stuff that many organizations do. Although in the homeless space, the amount of outreach that happens isn't what it once was. But these are the sorts of things, and it's around the world too. Australia, the UK, this is the kind of stuff that's the go-to. And if you hear us here where the dialogue needs to shift, we need to do a lot more than giving out water bottles and opening up, armories and church basements in weather extremes. You can go to the next slide there, Mariya. Thanks. So I think this is on you. So Mariya is going to give you a sense. So we're kind of covering, hopefully you're staying with us. I talked too fast. Apologies in advance about that, or midway about that. Mariya is going to share with you, some of the sources of the information I've started to share, but then also where the information that's coming up, where it's coming from.
So this is going to be pretty brief for this presentation, and in general for the knowledge we're gathering through the McConnell Initiative. We are using these sources so far. So we've done 3 reviews. one review of reviews on homelessness and housing precarity globally, and two scoping reviews, one also on homelessness and one on brain development, and from prenatal to all the way to the youth. We've also built a response framework, mostly focusing on, again, homelessness, with exposure and migration being two overarching themes. We also held 7 think tank events with a global network drawing on experts from all over the world. And now we are drawing in closer to home. We're holding many think tank events with Canadian experts, focusing in on the specific groups of particular risks that we have covered previously. And yeah, for further information about the resources that are available, you can look at the 2 websites provided. I will throw them into the chat at a later point.
Okay, thanks, Mariya. And if you can infer something from how we're doing this, it's that for people experiencing poverty and other associated forms of marginality and discrimination, we don't have a lot of evidence. There's not a lot of evidence out there. And from a global health perspective, ironically, we have the most evidence from the countries least impacted. It's not to say we don't have impacts in Canada, the US, and UK, but that's where almost all the evidence is when you consider Africa and South Asian countries, where the impacts are far, far greater as much as we're experiencing them. So that's why we have a lot of think tanks happening, trying to get experts together where the gaps are and getting the best available advice about what we should be doing and what the issues are. So we're doing that in Canada and nationally. And you can stay tuned as well. We'll have an opportunity for you to keep in the loop as this moves forward. So we're going to drill down on a few topics a little bit and then head in the direction of evidence and examples of responses. So in thinking about how to respond, and I should say as well, I know that, for me, this, as I mentioned, this is kind of only in the last few years of my 20 whatever year history of working in homelessness, mostly youth homelessness. Only the last few years, I'm really starting to turn my attention to this. I think this is happening everywhere. The climate crisis has stopped being sort of this abstract thing that's out there. Health systems, governments, hospitals, service providers of different forms are increasingly realizing this topic needs to move higher and higher on the priority list. And so that's kind of, we're trying to inform all that. But in terms of housing, in terms of topics, with a really complicated problem, like, the implications of our changing climate and other environmental crises, climate changes and everything, is where do we how do we target interventions, and what should we be measuring? Where should we be measuring things? Where do we intervene? Because you could be doing, like most poverty related things, you could be doing 30 or 40 different interventions at any one time. We'll never have the funding for that. So like, where do we really target efforts? And an argument we make constantly is that housing is key to all of this in terms of exposure and protection. So in terms of homelessness, climate change is, we see globally, it's a driver of migration. We see it a bit in Canada, although it's happening with people exposed to fires, and as well thinking about who's exposed. I mean, if it's your country home that just went up in smoke, that's really terrible. But if that's your only home, you didn't have insurance, you're maybe renting, your home's lost, then you're migrating and perhaps entering homelessness. And this is something that's happening in Canada to a much lesser extent than other parts of the world, where hundreds of thousands, if not millions, are being displaced. But there's going to be a global migration element. It's already happening, where people are turning up, and even the term climate refugee is starting to be used. And we're going to see a lot more of this, even in Canada, where we're relatively buffered. You see it in the States, the number of people moving north is this kind of global condition of people migrating. What are they migrating into? Typically housing precarity and homelessness. I've already mentioned the exposure sorts of pieces here, and I think I've already covered the kind of pre-existing physical and mental health conditions. So this is where we're trying to make a point, amongst many points that could be made, that really housing and having adequate housing is at the center of a lot of what we need to pay attention to if we're going to reduce the amount of exposure impoverished populations experiencing poverty are exposed to, and then also, of course, the health and well-being impacts downstream. You can go to the next slide if you want, Mariya. And I'll drill down a little bit here. I already touched on heat and pregnant women. we did this review, and it's sort of sadly, it sort of seems like every time we do a review, every time we do a drill down on this topic with another angle, it's sort of even kind of more disturbing in terms of thinking the breadth of the impacts. But just thinking about brain development. So there's a lot of discussion about climate change, the climate crisis, and youth mental health and well-being, and mental health largely, right? Like climate anxiety, eco-anxiety, all of these terms. But the angle we want to look at is more brain health than mental health in this review. Is like, what are the implications of all these climate impacts on developing brains? Because of course this has huge implications for an array of developmental conditions, for cognitive capacity, for a whole bunch of an awful lot of everything from longer term health outcomes right through to economic productivity in countries rolls off of having people grow up in safe environments with the right amount of stimulation and support so they can reach their full potential, right? So I've touched on heat extremes, substantial implications for child and fetal health, child and youth health and brain development, and also a lot of evidence there about along with weather extremes broadly, like the ice storm in Eastern Ontario years back, but really long-term consequences for cognitive development, for rates of ADHD, ADD, other conditions that have a developmental aspect to them. All of these challenges have been tied in with sort of weather extremes and heat extremes. And it's something I think that often will fly under the radar. And so it's thinking about how we're responding is really, we need to be doing better and be paying more attention to, for more exposed populations, what's going on with fetal health, babies and children. Air pollution, there's a huge amount of data out globally tying in high exposures to various kinds of air pollution, particularly small particulates. This is the stuff living next door to a large highway. Here you can read environmental racism, and who's living right next door to the 12-lane highway are largely people experiencing poverty. And sort of exposure to air pollution has significant impacts on kids' IQs and rates of ADD, ADHD, and other later mental health challenges. Malnutrition, it's kind of again, something that can seem obvious, but is food and water insecurity, has significant implications for brain development. And then equity as well, is looking at who has the worst outcomes in this frame. There's been research out of the US with Black mothers showing that they're in terms of fetal health, infant and child development, they're experiencing far more challenge than white populations. And this occurs across the board on the equity front. So just thinking about the various angles here, we've covered some physical health pieces, the mental health pieces, but then also there's this development piece, which really, this is determining our future in many ways. And sadly, this is a topic compared to the attention given to things like climate anxiety. Don't get me wrong, it's real and important. It's broader than that, and hopefully that's a takeaway. Go ahead, Mariya. Okay, heading into the what do we do about this topic again? I've already touched on this idea. You might have heard in the public health frame. I think you do have a number of public health engaged people who come to the Alliance webinars, but the wicked problems, it's very much a public health 101 sort of thing. But the idea of these very complicated problems that impact health and well-being in many different ways with feedback loops. It's like the whole, the wicked cycle of homelessness, where once you lose your housing, a whole bunch of other health determinants collapse, and you end up in this kind of exponential cascade of challenge. It gets harder to respond. And sometimes responses that seem like they should work do nothing because they only tackle one part of a problem that might have 4 or 5 different determinants. So that's where the idea here is, how can we identify points of leverage? And the argument we make that housing is really key. Maternal health is another one that's really key. Like, where can we intervene that has the biggest bang for the buck? And also collaborative responses. This is not a one sector response. Like, we've got, unfortunately, responding to climate change and environmental risk in Canada, we've got 3 levels of government. This is cross-cuts many different departments, different governmental portfolios. So if you have a look at it, you should check it out. The National Adaptation Strategy that the Canadian government just published about a year ago now, is it really a theme throughout that is on how do you bring different levels of government together, different portfolios together, to work with community sectors to actually have whole system responses, because any one part, if we're relying on what happens in ERs, we're not going to get anywhere with this. If we're relying on homeless serving organizations doing outreach, it's not going to cut it. So that's one piece here. There's a lot happening nationally and internationally, large scale efforts that are getting their feet under them. If you want to follow, I already mentioned the National Adaptation Strategy. A lot of governments are in early days here. We shouldn't be, right? Because I mean, this has been a major issue for a long time, for decades, but a lot of governments are starting to get together plans, and some large investments are going to flow in this direction. Planetary Health Alliance, if you want one-stop shopping for all things related to health and climate crisis, this is based out of Johns Hopkins University. You can join their listserv. It'll keep you tuned in to the big ticket items globally and what organizing is happening there. The Wellcome Trust in the UK, COP Squared. I won't go to town on all these, but just to know that there are these large scale frameworks and efforts emerging. And then as well, if you're familiar with like the Canadian initiative, the Reaching Home investment is, the Liberal government has been putting major amounts of money into trying to increase access to housing nationally, right? It's been something they've been at for a few years. Many hundreds of millions flowed forward. A challenge that's come up with that is how are communities engaged in the implementation and monitoring? And that's where you might have seen that rather scathing Auditor General review of the federal government's housing investments. It wasn't a nice one. It basically said, we don't know what happened much. We don't know, how it rolled out. We don't know if it worked. And yet huge amounts of money were put towards it. So this is where the point we and others, we're speaking for many, is saying that we really need to engage communities and look at how investment at a high level can then marry with and support community-driven responses, because it will be the communities that will understand their older adult population who are at risk. How do you reach them? Who's going to know who they are? How are they going to be engaged in response? What's going to happen there with disaster planning, identifying risk? Is, you can't have a federal grant come in and then no understanding really on how to deploy in the community. And as well, too, within communities, how are they supported? It's something that winds me up. I've already talked a bit about being wound up about things, but you'll be familiar with maybe with the, the big deinstitutionalization debacle in mental health, where we closed a lot of the inpatient wards back in the 60s and 70s. And the big hope was the communities would pick up the care, right? Now that people don't need to be on back wards for decades. Well, the communities were never invested in. That money never flowed to communities. And so now we've got this patchwork of underfunded and disorganized community organizations trying to pick up the pieces. And that's where here, if we're going to have responses, we can't say, oh, it'll happen in the community, and have some faith in some underemployed or unpaid people to somehow implement these things. And there's as our think tank, our women's health think tank actually raised something important here in community responses. I don't know if you've noticed, but I've certainly noticed in my world, who's involved mostly in most of the things happening in communities? A lot of women, right? It's a lot of women's work that goes into community organizing and community responding, often unpaid or underpaid. So there's a gender equity element here, amongst many other points of equity. But just to give you a sense on, there's a push and an emphasis that we need to fund community hubs, the kinds of people that organize at the community level, so that they can then do the assessments and do the deployments in a way that's properly supported. And it's not this whole, the magic will happen in the community somehow. It's almost getting rant-like there. I'll drop it. You got the point. So you can flip to the next slide there, Mariya. Okay, now you get a break from me, thank goodness. And you can hear from Mariya, who's going to give you a few examples, some really concrete examples of things happening in specific places that will probably speak to some of the themes that I've talked about.
Yes, that's exactly right. We've covered homelessness and children and youth in our determinants of health. So we decided to zone in on the case examples pertinent to these two themes. And the first one is coming from Australia. It's called Out of the Storm, and this project was focusing on homeless populations and the outreach that can be done effectively. As Sean has mentioned previously, part of the problem is that homeless populations frequently do not access the resources that are available, even in terms of warming and cooling centers when they're necessary. So for this project, Dr. Avery and her team have designed a collaborative program and they have used the trauma-informed extreme weather resilience education that they have previously developed to inform the way the program is structured. The idea was to really focus on co-design, so they went to shelters and a few other places like a Red Cross in Australia. This was done in Adelaide, by the way, and they have engaged a few of the homeless participants there, as long as emergency services and house provider representatives, to really zone in on the issues as they can identify, and also the potential solutions or tips that can be shared with the homeless populations on the spot, and how to deal with specific situations. For this project, they were mostly focusing on dealing with cold in the summer, which is winter in Australia, and vice versa for the winter.
I might just jump in. Oh, sorry, Mariya. I was gonna when you pause, I was gonna jump in with a Toronto example that riffs on this.
Okay. So basically for this project, they have discussed and identified key issues and some of the solutions, and then they've engaged volunteer graphic designers who help to create help to create maps, which would outline where a person can go to get water, or to go to a free public washroom or a shower, or access a cooling and warming center. So all of these key points of information and resources that can be accessed by homeless populations were identified on these maps. And they've also designed posters that can be spread out in homeless shelters and meal serving programs that can be informative for the population. And finally, they have had an outreach team go out and key moments in the summer and the winter to provide emergency kits and to discuss the options available, or to answer the questions that people may have. So some of the things in the emergency kits were not necessarily immediately obvious how to use, so they would discuss some of those things as well. And they've made sure that this is done by peers, so people with lived experience of homelessness, so they have a better connection with the people on the street and needing support. Okay, I'm done here. You can go, Sean.
Yeah, sorry about that. Yeah. So an example, it just struck me just now is I've ridden the coattails of a project based out of Toronto. It's mostly, I find a lot of folks engaged in this space are ER docs. I think in part because they're the ones that see the folks coming in, with hypothermia, and heat stroke and injury and all that. I mean, the most direct sorts of things that many populations face. But they pulled together this project. Maybe many of you will have been in or seen, these pretty rough and really inadequate boarding home environments that many people experiencing poverty and physical and mental health challenges are in. Seldom with any kind of air conditioning, and poor insulation, poor quality housing. But we're doing a pilot of something where people who are doing outreach anyways, so these will be outreach workers, sometimes physicians, sometimes not. They know what these environments are, know the housing operators, but to go in, do a little bit of education, have a small education package related to what does heat stroke look like, what are the challenges, what do you need to do? And they got coffee mugs printed. Like, how do you make this something so that people remember? Is coffee mugs with some of these key signals of heat stroke and key things to respond about that can bang around these environments, so that it's this sort of like trying to engage environments where the risk is, but also in a way, I think a key lesson here, it's not some massive net new initiative. I mean, where everyone's strapped and stretched, but it's not too big of a deal to, if you're already doing outreach anyways to a setting, to bring some coffee cups, to take a few minutes to do a bit of basic educating and then check in on it later. So that's the kind of stuff that's been happening. Yep, go ahead, Mariya, you can keep on rolling.
Thanks, Sean. So the next case example is coming from Canada and is focused on youth. This was done in British Columbia in two rural communities of Ashford and Kimberley. So they've tried to engage local youth through arts-based programs. So for the first part of the project was photo voice. Youth were trying to take the pictures of relevance to them and share their experiences, explain what's going on in terms of the environment and how they are engaging with nature, how they are engaging with the climate change implications in their local communities and how the communities are dealing with it, what are the strengths of the community and what are some of the things they should be improving on. Then at the next stage, youth were provided with a choice of painting or engaging in song and video projects, and some of them decided to do painting and the other ones were focusing more on the video parts, and all along they were journaling as well, trying to see how the experience of participating in these programs is impacting the youth. So some of the outcomes of the program were seen to be empowerment, education, increased resilience, and it was also seen as protective for psychological well-being, because a lot of youth express that they understand better how to manage their anxiety. For a lot of the participants in this specific study, anxiety was one of the anxiety and distress were identified as one of the major factors driving their relationship with climate change in the world. So this was seen as one of very important outcomes. Another key point was that youth feel overwhelming responsibility for the changing climate, which can lead to burnout because they do not necessarily know how to engage with it and whether anything they can do will bring meaningful change. So this was one of the key points for this project, to make sure that youth can express their feelings, youth know how to engage with what's going on and understand that like there are some things that they can do and that won't necessarily solve climate change tomorrow, but their participation will matter. Yep, so that's the project there. And next we can talk about a little bit about policies for climate change mitigation. And I will try to speed this up because we've been talking for a while now. So we definitely need to engage the populations at risk more, and they need to be part of not just part of the planning, they need to participate in the planning and and be an active point in the policies and response plans that are being funded. Also, a bigger focus should be on prevention-oriented strategies, and the organizations that are working, as Sean has said, mostly like community organizations, are under-resourced. Well, they need to get better funding in order to continue the important work that they're doing within their communities. We also need to support public health messaging, and also focus on destigmatizing a lot of the issues surrounding specific populations at risk, and destigmatizing the idea of getting help, which can also be problematic for some people, as well as making sure that when we talk about populations at risk, those populations actually know who they are and can self-identify without feeling the stigma of being identified as at risk. And finally, one of the key points we keep coming back to is housing. So a national housing strategy that is cross-sectoral and that relies on interjurisdictional collaborations can really help us address a lot of the issues that people are facing with exposure to climate change. Okay, and I will give it up to Sean now.
Sure. Yeah, I was going to go through just in the interest of moving us along, and to see what we kind of already covered, sort of this whole notion of community response. I think we covered this to some extent, but really, I think if there's one theme here, it's in terms of designing responses, is whether we're funding responses or even designing responses, is this kind of high level top down approach doesn't work. We do need guiding principles and some evidence around what tends to work, but then it's going to be really engaging responders, and especially, you know, I work in the hospital too, is that we're all stretched. There's too much happening and not enough money to do it. But how can things weave in with work that's already being done? And then, you know, the cultural relevance of responses, and that's where community engagement and co-design and not having too many assumptions and kind of going in and doing proper assessments. A running theme across all of our think tanks, whether it's older adults, children, youth, women's health, or people experiencing homelessness, is really how can we do these assessments at a community level to really understand what people need and where the points of engagement are and what the resources are. And then as well too, figuring out, like, for those who have more complex physical and mental health challenges, is where more intensive models are needed. And obviously prevention is important here. In Canada, we should not have a homelessness problem, a major homelessness problem, yet we do. If we can get people some basic income, you know, seeing what's going on with universal basic income, get them access to decent housing, a lot of these issues and challenges go away. And it's so much better than chasing people around with water bottles. So that's just, let's tease out a few themes there if you want to go to the next slide, Mariya. Cross-cutting principles. I think we covered a lot of this, the lived expertise, inclusion, localized solutions. Yeah, I think we have all of that pretty much covered. We can probably flip to the next slide.
Well, and the next slide is I did that. Thank you.
Oh, there we go. Boom. Yeah, so we went on a little longer than we intended. Mostly my fault. And but now we can turn to the audience. It'd be great to hear some questions, and we'd be happy to field those. Oh, and I do see there's one key question in the chat from Tanya. I'm happy to start with that, if that sounds okay.
Absolutely. Sorry, I was just on mute there talking away. Thank you so much.
No worries, no worries. So Tanya's asking about, you know, reaching home funds spent on water balls. I actually didn't know that, so it's not surprising, but that's interesting. Misuse of funding contributes to climate impact. In terms of, I guess, taking a concern like this to higher authorities and better ways to invest, you know, I think there are a bunch of routes to approach that through. So thinking about bodies that are made up of groups like healthcare providers that are doing national level advocacy and doing government engagement and and being a part of those groups. So it's not one individual, you know, trying to vote a certain way or send a note to an MPP or MP and that sort of thing. But the Canadian Association of Physicians for the Environment, unlike its title, it's not just for physicians, it's for anyone working in healthcare. That's an example of a group that's been doing some pretty solid advocacy in this space and has been tackling challenges like this, like, you know, where this sort of funding is going and how it needs to be better allocated. And you're right in pointing out that's sort of a not adequate response meeting something that makes the climate crisis worse, and you're kind of giving out plastic, these sorts of things. So I think, you know, through those kinds of organizations, being a part of that and being a part of larger groups that are pulling levers, that's not the only one by any stretch, but there are other organizations too. I think, you know, the federal government will be, at least in its current form, if they are able to hold on to power, who knows what will happen if there's a shift, but they will be putting quite a bit of money into response, a la kind of reaching home. I guess the push that myself and many others have been saying, I've mentioned already, this community assessment and engagement is what, like, for example, the city of Toronto has some department leads that are on point for all things climate for the city of Toronto. So trying to engage local governments and local organizations that will have a say in this space, so that when the feds hopefully are coming out and with calls for proposal and are asking for advice, is that these organized elements can then be sharing back that, no, we don't want, you know, 20 truckloads of water bottles. Here's what works for us. And that, along, I guess, with the kind of ability to vote and, you know, and write and do organizing as best we can. So I think in the end, the greatest traction is going to be, you know, these more established, trying to hook up with more established groups. The challenge in this space, like a lot of activist and kind of politically engaged spaces, you've got so many actors, so many organizations, which are 98% pointed in the same direction. It can be hard to pick and choose where to put your time and energy. But yeah, I guess it's trying to find some of the ones that seem to have a little more political clout and engagement and joining them.
Thanks, Sean. I'm going to jump in and kind of bring a couple of questions together that have come in. So in the chat, Carol addresses funding. She says a key issue is accessing funding to support engagement efforts with populations experiencing health inequities, and asks if you have suggestions of where to access such funding. And Andy in the Q&A similarly says one of the challenges that CHC staff are experiencing is burnout just from trying to address the social determinants of health for clients and communities. Asking them also to address environmental determinants of health is overwhelming for many. And again, you know, we need resources in order to be able to do this in meaningful ways.
Yes, I mean, it's another question I think that would have a few elements to it. And I think first off, I don't want to sort of convey or come across in some sort of Pollyanna-ish way that our current state, that we're even remotely, first off, organized well on this front, but then also adequately funded. So I think that's at a very basic level. I very much empathize and in many ways live the struggle that's being raised. And I wish I could point to, you know, sources of funding you hadn't heard of that we could kind of go to for this sort of thing. I think that, you know, I think there is a piece here that's germane to what I just said earlier about the kinds of groups, organizations like CAPE, for example, that is pressuring government along these lines. And that is the kind of pressure that will then translate into, you know, a good chunk of this money will be federal money. The provinces are kind of hit and miss, of course, on this, as some provinces are building more highways and homes and green spaces, and other provinces have more of a stake in this. And then the municipalities are often, of course, not resourced remotely enough for this. I know Toronto's is badly in the red, for example, Toronto's not in much of a position to fund much of anything these days. But nonetheless, I guess it's going to be exerting that kind of pressure. I mean, there's a scarcity of grants and its sources of money. However, they should be increasing. You know, there are large commitments coming along these lines. So be sort of keeping an eye out for the sort of you know, requests for proposals that might come through the federal government. And if they do what they say they're going to do, is how are they funding the municipalities? So the municipalities then flow out the money probably in a much better way because they'll know what's going on locally better. Burnout of staff, absolutely. This is kind of certainly adding something. And I'd say it's probably not something net new. I'm sure like any one of us who's doing outreach and engaging folks this summer, for example, we're kind of seeing the impacts of exposure to smoke and heat and all these pieces. I think that what the best response on that is, along with just all the general practices we can do with shoestring budgets to help keep staff healthy that we don't have time to get into. But on this front specifically, is how can, like everyone's concerned about this, how can we provide outlets for those concerns? Like at CAMH, there's a small interest group that meets once. I know this sounds like small potatoes, but it's not. A small interest group that gets together virtually once a month to talk about climate pieces. And, you know, we're trying through as an organization to create a platform for that. People can share their concerns. How can we educate our staff a little bit? Like this isn't heavy lifting. Do some education, have some places where people can convene, where people can plan and feel like they are making a difference in a positive sense. And this is where, you know, those avenues for community-based responses, resilience-oriented responses, as that kind of organizing and involvement. I think creating paths for involvement that aren't some massive net new project. And you've already heard my half rant about resourcing community, that ultimately this is where the hope is that governments will realize you need to fund community hubs, the sorts of organizing elements in communities to support this sort of thing. But at a very basic way, I think acknowledging this is real, and this is, you know, it's natural to be stressed about it, and even feel some hopelessness about it. But as well as what are those small avenues? I shared this tiny, very low budget project in Toronto where we're giving out coffee mugs that have information about heat stroke on them. costing not much of anything. I mean, there are versions of this where you can be doing something, and this is, I mean, people are doing the outreach anyways, and they're already there. So there's a chance to do some of this work that's really not much of an add-on, and is getting ahead. Because I mean, something like a heat wave is, no matter what our work is, if it's in physical health, mental health, determinants, you name it, we're seeing the outcomes of that, and people getting really sick, dying, having health crises. So this is kind of, in a way, doing what we are doing anyways. It's trying to get ahead of risk and help people related to these pressures. So, and then, as well, too, I guess, enabling people and with a bit of education to ask questions. Because if someone is perhaps not educated about the risks of heat exposure for pregnant women, will feel a bit armed, knowing that, hey, this is something I should be paying a little more attention to as I'm doing my outreach, working with my folks, and can then feel like they're making a difference with that person, because, hey, they caught this mom who is no air conditioning, is complaining about a lot of heat, and I need to spend a little more time with her on how she can keep safe for this week, this month. So, I mean, that's the kind of stuff I think that can give people a sense of efficacy in a challenged frame. So please don't hear me as this isn't, a Pollyanna-ish kind of, this will fix it. But these are the sorts of things that we can do a bit of now, but we need to do a lot more of.
Thanks, Sean. And I was also just remembering, some people here on this call will remember back in the early part of the year when the government suddenly announced $30 million to be sent to healthcare organizations for mental health initiatives, had to be spent by the end of the fiscal year. And organizations were kind of scrambling, saying, wow, if we could have had this sooner, we could have done a lot more with it. But, that's the kind of thing, if you just kind of have that climate lens, then I think when things like that come up, maybe you spend that to get, have this a group, a youth group that can meet to, talk about climate anxiety. Maybe you can step up some of the outreach areas. And again, sometimes it involves thinking creatively. It might not be something you call a mental health program, but it's very clearly going to be advancing mental health. Also thinking about social prescribing, if your organization is involved in a social prescribing program, maybe you have some funding for that. How can you put a climate lens on some of the social prescribing activities? And again, including people who are experiencing homelessness, or having, again, things that address, youth mental health, or prenatal health that's related to climate change, and connecting that to sort of the social prescribing and maybe not clinical elements of the work that most of our members do. Sometimes it's just putting that lens on the work that you're doing.
If I might just add, and I completely agree with all the points you just made, is how can we as a society think ahead? Because we in healthcare, I know that we're so often reactive, and we feel like we're just keeping up with what's happening now. But looking at points to pressure governments and to put effort, how are we educating children and youth about this? Like this, a big emphasis, like this should be like sex ed, is every kid should get some basic good quality education on what's coming, how they can prepare, and how, this across our think tanks, we heard many people saying we don't need to plan for the now and respond to the now. We need to think about what's going to be in 10, 20 years. And to think, like, in this, we had a small taste of a whole system response in the COVID-19 pandemic. But I think that's the kind of frame I hope we can get towards in terms of thinking a whole system response that's geared to not the pressures of now, but what's coming, and how can we prepare our children and youth so that they don't feel like they've just been sold down the road and there's nothing they can do, but they can go in educated and ready to face some really challenging stuff.
Thank you so much. And it is about 2 minutes to 1 by my time, and I'm not seeing any new questions in the chat or the Q&A. So going to just get us wrapping up, but just a reminder to everybody, we will be sending out a recording along with the slide deck and a list of the resources that were mentioned during the webinar. And Mariya posted in the chat the email address to stay in touch, climatehealth@camh.ca, to keep in touch with updates and the work that Sean and Mariya and their colleagues are doing. I'm also just going to mention quickly a couple of other resources, and I've got some QR codes up here. If you're quick, you can scan them, but again, we'll include these in the resources we send out. The first is the Provincial Climate Change Impact Assessment. It was just released by Ontario government on August 25th. It was commissioned in 2020, completed and submitted to the government in January 2023, and just released to the public last month. And there are a lot of key messages in it that are relevant to our sector and others who are joining us in this call, specifically talking about how climate change can threaten food security, housing, health, and economy, and how it will amplify existing disparities and inequities. And the other is for those on the call, and our members will apply, but I think others here may as well be affected. Those of us who have our retirement plan with HOOP, Healthcare of Ontario Pension Plan. There has been a campaign underway for several years to convince HOOP to divest from fossil fuels. There's an organization called Shift Action for Climate, Health, and Pension Wealth, something like that. I'll send a link. But Shift has noted that in response to some of the pressure, HOOP has shifted slightly, but have not yet committed to full transparency or divestment. So you can read Shift's response, and there's an open letter calling on HOOP to do more that you can sign. And that is the end of our conversation today. I want to thank once again Sean and Mariya for your time and your insights today. I hope that people on the call found this valuable and will be able to connect with some of these ideas and resources and bring them back to their organizations and their communities. I want to thank everybody who took the time to join us today. And again, please watch your inbox for that follow-up. Thank you very much and have a wonderful rest of your day.
Great. Thanks so much.
Thanks. Bye.
Bye.